Good morning, everyone. I would like to talk about my PhD thesis, which is titled as Natural Orifice Specimen Extraction in Benign Lesions, in the following minutes. So, please allow me to introduce myself. My name is Botond Bényi. I'm a sixth-year medical student at Semmelweis University. My supervisors are Nandor Ács and Attila Bokor. My SMS is Lorenz Frivalski. My vision is an improved quality of life in patients who suffer from benign intra-abdominal lesions. And my mission is to find the most effective surgical technique for the treatment of benign intra-abdominal lesions. We have two ongoing projects. In the first one, we investigate the safety and efficacy of natural orifice specimen extraction technique in the treatment of benign intestinal lesions. And in the second project, we investigate the same technique, but in the treatment of benign uterine and adnexal lesions. So let's start with the first project, which is titled as Investigating the Safety and Efficacy of Natural Orifice Specimen Extraction in the Treatment of Benign Intestinal Lesions. So, globally, around 240 to 300,000 bowel resections are performed with minimal invasive techniques annually due to benign lesions such as deep endometriosis, diverticulosis, diverticulitis, volvulus, or IBD. The resected segment can be removed through an artificial orifice, like a financial incision, or a natural orifice, like the anus or the vagina. But the incision used for the specimen removal results in the loss of advantages of minimal invasive techniques and then increase the risk of hernia, fistula, wound infection, postoperative pain, and psychological distress. However, the natural orifice specimen extraction technique has emerged as a rising star in the field of minimal invasive surgery, so we hope that it can be the way forward to show advantages in postoperative pain and psychological distress, to reduce the risk of wound infection, to improve the bowel motility, and to show aesthetic cause. So our aim is to assess the safety and efficacy of natural orifice specimen extraction in the treatment of benign intestinal lesions. At the end of the day, we would like to know if NOS provides better clinical results and fewer surgical complications compared to conventional methods. In our project, the population is patients with benign intestinal lesions. We compare NOS technique to conventional methods, and we examine the surgical and functional outcomes and complications according to Cleveland-Dino classifications. So, for example, infectious complications, rectal bleeding, ileus, anastomotic leakage, rectovaginal fistula, or return to flatus. In the search key, the first domain refers to population. In second domain refers to intervention, and the third domain refers to comparator. As you can see, we have a little bit more than 11,000 of hits. There is previous systematic reviews and meta-analysis and prospective registration in this topic. But previous projects compared the NOS technique to conventional methods, either by discussing benign and malignant lesions together, or by examining only one specific disease. But the surgical results of benign non-gynecological diseases are more comparable to the colorectal resection, also the results of colorectal resection used in deep endometriosis, than the results of malignant disease. So that's why malignancies are not included in our project. So at the end, we will obtain a more homogeneous patient group with better clinical characteristics, and we will have a larger number of benign cases. So, as you can see, we are at the stage of title and abstract selection, what you can see in the flowchart table too. So let's continue with the second project, which is titled as Investigating the Safety and Efficacy of Natural Orifice Specimen Extraction in the Treatment of Benign Uterine and Adnexal Lesions. So in the US, about 600,000 uterine and 500,000 adnexal surgeries are performed a year. And approximately 70 to 90% of these are performed for benign conditions like uterine fibroids, adenomyosis, benign ovarian cysts, or endometrioma. And here also, the resected segment can be removed through an artificial orifice, called as mini laparotomy, or a natural orifice called as the vagina. And the transvaginal route appears as a good alternative, as it is easy to disinfect, and it's easy, and it permits an easy entrance and a safe closure. So the abdominal incision used for the specimen removal results in increased risk of hernia, wound infection, postoperative pain, adhesion, bleeding, scarring, and longer hospital stay. But the advantages of nose technique include a decreased risk of wound infection, a reduced postoperative pain, and a faster recovery. So that's why we hope that it can be the way forward. And our aim is to assess the safety and efficacy of natural orifice specimen extraction in the treatment of benign uterine and adnexal lesions. So at the end, we aim to determine whether nose provides better clinical results and fewer surgical complications compared to conventional methods. In this project, the population is patients with benign uterine and adnexal lesions. We compare nose technique to conventional methods, and we examine surgical and functional outcomes and complications like postoperative pain, length of hospital stay, cosmetic scores, and the infection rate. In the preliminary research, the first domain refers to population, and the second one is to intervention. As you can see, we have a little bit more than 8,000 of hits. So the plan is to submit both of our project in the fall of 2025. And I would like to say thank for your kind attention with a quote from Arthur Ashe. So start where you are, use what you have, and do what you can. Thank you very much.
Congratulations for the nice presentation. My question would be for your first project. You examine benign intestinal lesions, but I have one problem with the IBD patients. This disease group is, by nature, has much higher chance of complications. So what do you plan to do with the difference in complication rates?
Yeah. Thank you for your question. I consider it is a very important aspect of this topic. So given that patients with IBD have more complications, they are immunosuppressed, and they have worse wound healing. If we have enough data, we will plan to use subgroups, and we will plan to analyze it in different subgroups. Thank you very much.
Perfect, thank you.
The next question, please.
Hi, great presentation. So do you know currently what percentage of surgeries are done via the nose technique compared to like the conventional ones in the, for example, the first project?
Thank you for your question. So the rate of usage of nose technique or the popularity has increasing with the hope of minimizing the complications and fostering the recovery. And globally, the rate is now below 10%. But the exact rate may differ between hospitals and between countries. Thank you.
So my question is that The conventional method refers to both laparoscopic and open surgery. So you want to compare them both, or you have one specific?
Okay, thank you for your question. Also, now we are at the field of minimal invasive surgery. So in this project, or in both projects, we compare the nose technique to only minimal invasive surgery, so the conventional minimally invasive techniques.
Thank you very much.
Thank you.
Thank you. So, to the previous question, there is no question in the open surgery because you have an incision and you can remove the specimen in this. So there is no question. So it is only in the minimal invasive field. My second one, exactly, it is very interesting for me. So where is the incision on the vagina? Do you know where is it? Because if it's under the peritoneal part, so then if you operate in the peritoneal part, you have to go down there. So where is the exact incision there?
Okay, thank you very much. Also, as I'm not working in a clinic, so I'm just a 6-year medical student, so at the moment, I don't know in which level is the incision in the vagina, but I know they use the back, or the back side of the vagina for the incision.
Okay, thank you.